Hello.
Hello.
Hi, Peter.
Hi,
Yes.
Dr. Smita.
Yeah.
I'll,
Okay. Shall.
I'll just introduce you. So welcome
Yes.
everybody to this preview of our CBT course. Um, I'm delighted to be able to bring you Dr. Sumitra Pramadasa, a superb therapist, somebody again I've known for a very long time. And basically, Dr. Sumitra is a medical doctor, trained as a medical doctor, and decided to train as well in clinical hypnotherapy. And as part of her journey with bringing things like clinical hypnotherapy into her medical practice, she also trained in CBT, REBT, and has since become the stalwart of this particular course that we've been running for quite a while now. Um, and through her years of experience, she's been looking at the course and upgrading things left, right, and centre, which is making sure that the course that we are talking about is really meeting people's needs. And as part of the work that we've been doing with CBT, she's also taught CBT to government institution Picasso, which I'm sure she'll let you know a little bit more about in a moment. Um, so, um, uh, so you're not here to hear me. I'll hand over to Dr. Sumitra. The floor is yours, Dr. Sumitra.
Thank you very much, Peter, for that introduction. Yeah. So I think most of you all are here. Some of that you at least you have met me, known me. So yes, like Peter said, I have already been teaching CBT, the CBT course that we conduct in LCCH for quite some time. And I have also treated people with REBT. And we are going to now today uh, to introduce you to this really wonderful uh, branch of psychotherapy. Okay. So what we need to understand is this. It is something that you can include in your whatever kind of therapy you are doing, whether it's hypnotherapy, any kind of other types of psychotherapies. If you have learned and you are practicing, once you do this, you can very safely incorporate this method also into your practice with your clients. So it is a beautiful kind of psychotherapy. It's lovely to learn, really, and I have been teaching it, and I like to teach it also. So I will just put up some I'll share my PowerPoint with you. Yeah, we'll go through these quite quickly, and it is important that we understand what is it that we are actually learning. All right, I hope you are getting you can see it, I believe. Yeah. Oh, sorry, I was just checking it just now and I went down. Sorry. All right. So this is me. And so we're talking about cognitive behavioral therapy. We know that there are many modules or models of cognitive behavioral therapy. Mainly, you may have heard about the Beck's model and Ellis's model. So these are the main branches of cognitive behavioral therapy. So today I'm going to introduce cognitive behavioral therapy and the version of cognitive behavioral therapy, which is rational emotive behavioral therapy. So, so cognitive behavioral therapy, just to say, all of you must have heard about this. Definitely, it's a type of psychotherapy that that will help people to change their thinking and their behavior when they have issues that are disturbing them, they can manage, help them to manage these problems and disturbing situations when they are taken through this psychotherapy, which is cognitive behavioral therapy. So it is a form of psychological treatment. It is, again, psychotherapy, and it also is mostly a talk therapy. So the therapy is conducted unlike hypnotherapy. Let's say if you have learned, hypnotherapy is at a very subconscious level, but cognitive behavioral therapy we conduct at a very conscious level, completely conscious level. It is active, directive, that because the therapist will direct the client, and the client will actively participate in the process. So the client is fully engaged in the process. It's a well-researched research branch of psychotherapy, and it involves efforts to change thinking patterns of people, and by that is done by detecting and understanding the negative thoughts and the negative behaviors that the people have when they are undergoing stressful situations or any kind of disturbing situations. So this branch of CBT will help the clients to taking them through this process to reduce the psychological disturbance or suffering that the client is experiencing. And it actually involves a paradigm shift in therapy when this was brought about in helping emotionally troubled individuals. As I will go into a little bit more detail about this, Albert Ellis was a person who he was a psychologist, psychotherapist in the 1950s. When Albert Ellis brought this concept, Freud had already started his theory of everything dates back to childhood difficulties. So, but Ellis popularized that insight now that our emotions come from our thinking about events, whatever is going on, but not from the events themselves. And even those events experienced in our childhood also takes the same cause. So he brought a very new light to the psychotherapy. Uh, to tell you, numerous research, lots and lots of research have gone in, and research is ongoing, and the CBT leads to significant improvement in functioning and quality of life. This is what they have come to, the conclusion they have come to. So it's been demonstrated to be effective as more effective than, you could say, some other forms of psychological therapy or even psychiatric medication. So advances in this branch have been made on the basis of both research and clinical practice and collection of cases that are contributed by the therapists and all. And it is an approach for which there's a lot of scientific evidence there is that this method have been developed. Actually, it produces change in people. And tested the research were carried out like randomized trials and active comparators of those who were involved in the research work. So they were very, very stringent. And first psychotherapy, CBT is the first psychotherapy largely identified as evidence-based in most clinical guidelines. And yes, no other form of psychotherapy has been shown to be systematically superior to CBT. So moreover, CBT is the theoretical models and the mechanisms that produce change have been most researched and in line with the current mainstream risk paradigms. And there is still room for further improvement. Therefore, all these people who are the experts in this, they're actively involved in researching and adding new insights and new methods to this particular therapy form. So now I spoke about cognitive behavioral therapy. Now I'm going to talk about rational emotive behavioral therapy. So what is this rational emotive behavioral therapy? So this is a therapy that I was speaking about just now, Dr. Albert Ellis had brought up and popularized with a lot of acceptance. It is a version of cognitive behavioral therapy. And Albert Ellis is a psychologist. He came up with this in the 1950s. And he researched into Eastern philosophies, Western philosophies, and many extensive research he had done. And he came to this conclusion that circumstances do not cause symptoms or the disturbances we go through, but our perception of whatever is going on is what is causing the symptoms or the disturbance. So this is the basis, actually, the fundamental basis of rational emotive behavioral therapy. And it is, again, CBT, therefore action-oriented. It's a humanistic approach, and it really produces emotional growth in people. And that stressor, that individuals, our capacity for learning, creating, and altering and controlling our emotional states. So it really empowers us, the clients, or anyone who has any problem. And if they are taken through this particular model of RABT, there is a good chance of them becoming even their own therapists. This is one of the very different point about REBT, unlike other kinds of cognitive behavioral therapies. So it also, you will work with the client in the present. Only whatever they are thinking, their beliefs, their attitudes, and their painful emotions, and any kind of maladaptive behaviors, if they have, they are considered as the current problem. It does not matter where it came from. What are you going through now? So all these negative, painful emotions, negative beliefs, and maladaptive behaviors, they sabotage a fuller experience of life. So what are the goals of CBT, REBT? The change in beliefs. This is what the main aim of taking a person through REBT. And changing this belief, we'll go into the details a little bit in a little while. So the change in beliefs reduces the symptoms of the whatever emotion they are going to. They are very disturbed, they are anxious, they are angry, any kind of emotion that they cannot handle already. So when they actually are helpless and they can't get out of their emotions and disturbances, what REBT does is it identifies where does that emotion or disturbance comes from. So generally, it is supposed to be the belief, as I said earlier, that we hold, regarding that problem, that event that happened. That seems to be producing this disturbance. And it also, the goal is to for the client to gain insight on the effect of past, present, but at a current time, and give cognitive skills to promote rational thinking and thereby changing their behavior, which is negative, and allowing them to experience more controllable emotions, and which will help them to come out of their suffering that they may be going through. So it's just this Seligman and Richenberg have thought that change only occurs when people recognize and accept that they are largely responsible for creating their own emotional problems. So emotional problems are seen to stem from irrational belief. So this is the most simple explanation about why are we going through this. We have a belief, and that belief was created by looking at that event that was unpleasant or disturbing. So only we get, emotional problems are seen to stem from irrational beliefs. And so the only way to get rid of the problem is to change the beliefs. So if you realize this and remember this and understand this, then that is REBT. And so REBT also propagates self-acceptance. Emotional difficulties are always, is the result of conditional self-acceptance. If I don't do this, I'm not good. If I don't have that, I'm not good, and so on. So self-acceptance in us, in people, human beings, is very conditional. So they view value themselves because of their accomplishment, and therefore they do not value them if they fail to accomplish what they see as they should accomplish. So individuals have realistic sense of their strength. Actually, we all have strengths and we all have weaknesses. So in order to have this healthy acceptance of self, rather than a conditional one or none at all, we have to work on that. So it is a very beautiful thing that REBT teaches. It helps people to assess their thoughts, their behaviors, what's going on with me, rather than myself. Okay, what is happening to me rather than myself. So this philosophy is mainly based on this REBT is mainly based on a philosophy which was a Greek philosopher who lived in the 50 to 150 BC. He said that people disturb themselves not because of the events, but the view they take of them. So this is what I just explained a moment ago. So this is Epictetus. This philosophy is mainly included in the process of REBT. So the primary goal of taking a person through REBT, or you going yourself through REBT, is, it is rational emotive therapy and education. We educate our client. Unlike other methods, as you take your client through REBT, you're educating your client. And this education is that this will lead to how you can live a non-self-defeating life. How could you be happier, not feel happier? And how can you live self-actualizing lives? This goes into all areas of of our lives. And so that what happens when this is achieved, uh, the client, us, we can really truly get better instead of feeling better, because those emotions, those disturbances that the client came with, or what we are having, is completely understood. This understanding the emotion is a kind of education that your clients will get. And then if the emotion is dysregulated, this process will help the client to regulate the emotion and express them appropriately. So if maybe you're thinking, oh, how many sessions and all that, it all depends on the problem the client comes with, the length and the depth of the problem, and so on. And also, so you can't really tell one, but sometimes it has been, in certain situations, 10 to 12 sessions have been, been enough. But again, it all depends on the client. And it can be practiced on adults and also children. So, okay. Our emotions come from our thinking about events, not from the events themselves, even those events experienced in our childhood. So always, this is the basis you need to go on with your client. Even if they come and tell, I had some problem during the childhood and I'm disturbed about it. Okay, yes, you had a problem in your childhood, but what are you feeling now? What is your disturbance? What is your emotion? Do you have right now any maladaptive behaviors and so on? So that is the difference also in taking your client with REBT. Yes. Yeah, this I think is okay. So this is the next thing. Now I was talking about beliefs. Now we tend to have some common beliefs different people have different irrational beliefs that we live with generally. We don't even know that we are having irrational beliefs. But we can recognize, when I am putting here, think and see whether you have any more of these irrational beliefs. Okay, irrational beliefs are the things that are going to unhealthy, or irrational beliefs are things that are going to disturb us. So, do you ever think I'm only good as what I achieve? Or if they don't love me, then I'm worthless. And other people should follow the rules I know to be right. It's not okay to have these feelings. I should just be happy. The problems in these relationships are all my fault or their fault. And this situation is hopeless, nothing will ever improve. And if this person doesn't like me, then other people must also feel the same. And I must be able to do it all, everything. If I can't, there's something wrong with me, or my life is too hard. Life shouldn't be difficult and frustrating. Anger is not safe. I must not let myself get angry about this. And any one time in our life, we must have had this kind of thoughts or beliefs. So these are unhealthy beliefs to have. So when people are going through difficulties, they tend to have these unhealthy beliefs, and these beliefs are the things that are causing their emotional distress and any other kind of suffering. So that is why I put this here. And so self-acceptance, as I just mentioned, the emotional difficulties are always we found with people. But I have a little yeah, this is the one. So this about self-acceptance, I can only safely explain this to you. We are made of, ourselves is made of so many parts. We have good parts, bad parts, mediocre parts, happy parts, all kinds of parts. That is us, our psyche. But when something very bad happens, that part, the failure, just sticks out, and you forget all about your good things. So when we take our clients through REBT, we are teaching our clients that we are all valuable, but we are all worthy human beings. So this is a very huge and beautiful philosophy that REBT teaches or everyone. So I don't want to go into too much detail, but here this ourself has many things, and what happens is when we go through something disappointing, that thing sticks out, and then we will be bothering about it and being disturbed about it, forgetting every good thing about ourselves that exists in ourselves. So therefore, people disturb themselves not because of the events, but the way they take of them. So Epictetus said this. And that is, REBT teaches people how to overcome problems and how to implement gratifying and realistic alternatives to their psychological patterns and problems. Now, REBT doesn't promise that they are taking all that bad emotion away. REBT recognizes that we have emotions, it's a spectrum, and there is healthy emotions and unhealthy emotions, healthy disturbances, healthy responses, and unhealthy responses. So when the response is healthy, you don't have to do any REBT. But when the response is unhealthy and people are disturbed, then REBT will be able to help the person by you taking taking them through it. So how to conduct REBT? There is no difference from other therapies. In this rational emotive behavioral therapy, very briefly, Albert Ellis came out with the model of emotional disturbance. So that model is called ABC model. And to change these beliefs that are causing the current disturbance in the individual, he uses this model. And this model helps to understand our emotional upset. I will show you the chart again. which is produced sort of, which is a consequence of a adverse or activating, upsetting event that we normally go through in life. And then we have a belief about that. This is the ABC model. So when that happens, unknowingly, we don't know that we are doing it, but we actually look at that event and we hold a belief regarding that event. And when the belief is negative or unhealthy, there is a consequence. That consequence is these disturbing emotions that we go through and maladaptive behaviors that we go through. So a activating event. So now Ellis says A causes B causes C. So A is the activating event, B is the belief, and C is the consequence, emotional consequence. But generally, day-to-day life, we never think of this belief. The moment something happens, oh, that made me upset. That particular event made me upset. What that person told me made me upset, and so on. So so when people are confronted with this adverse event, it's largely their beliefs, therefore, which are specifically irrational or unhealthy, that lead to the emotional consequence. So this is Elisa's ABC model. And it basically says that human beings are largely responsible for their own emotions and their behaviors. It doesn't come from outside. Your emotion doesn't come from outside. Your behavior doesn't come from outside, but it is all within you. So when they are negative, unhealthy, disturbing, then you find yourself being helpless, hopeless, and start having all kinds of maladaptive behaviors to overcome them. So this is called the general principle of emotional responsibility in REBT. That means human beings are largely responsible for their emotions and behaviors. So now let us say something happens in your life. Like, let's say you're in an office and you are working in an office, and then your boss one day asks you to do something, and you do some project or a report, and you take it to the boss and you submit it to the person. But unfortunately, your superior doesn't like it, and he starts telling anything he likes. They degrade you, this is absolutely nonsense, and I don't think you're up to this. Anything can go on. All that come when you feel it. Of course, you feel disturbed. You feel angry or feel frustrated. You feel disappointed, depressed, any of those, any emotion. And then what do you think? She made that, what she did affected me, and I'm now having emotional disturbance. Now I'm upset and I cannot take it. So this is called AAC thinking. The activating event caused my emotion. But here is where Ellis puts the B in between. That activating event didn't cause your emotion, but how you looked at that, event is what caused your emotion, and how you looked at it and how you responded to it. She shouldn't have done that, or he who shouldn't have done that. That was absolutely unfair. That shouldn't have happened. So you have some rigid beliefs about what happened. So this is the root cause of the problem. Ellie says, whenever we get upset, anxious, angry, depressed, any kind of emotional disturbance, usually due to some sort of adverse event that we spoke about, we have generally very little control over, or no control whatsoever over those adversities, and we get upset. And the general belief is the event caused me to feel anxious. That is the consequence, the emotion that the person goes through. And this is called, that event caused me to feel anxious. So there is no belief in between, but this is called AC thinking, as I have mentioned just now. So now A causes B causes C. In this ABC model, we start with adversity A, then the belief B, and it's the C. And when we see a threat coming from any kind of event, then like you're going to be laid off, think you're going to be jilted in a love affair, think financial crisis is about to happen, and you begin to feel anxiety and disturbed. So then when people are disturbed, they think, feel, act in dysfunctional and self-defeating manner. And when they undisturb themselves, they almost invariably change some of their cognitions, their thoughts, and thereby they change their emotional reactions and thereby change their unhealthy or maladaptive behaviors. So this is what actually happens in day-to-day life. If any one of these things happen and you think your first impression is that that particular activating event caused my disturbance. And then this is what we are going to change through RABT. So when we change it, the person who had all these disturbing thoughts and dysfunctional behavior, through RABT, we undisturb them, the whole understanding, undisturb themselves, and then they completely change their activities, their emotional disturbances, thoughts and cognition states. So again, if that, let's say there's a relationship going on and one partner doubts about the future and he thinks, oh, it's really good now, but is it going to last? So you can even imagine things that are not that are going to go wrong and become anxious about it. So majority of a thing, the possibility of a relationship ending is what is leading to my anxiety. No, but how are you thinking about it? How are you thinking about the possibility of ending the relationship is what is disturbing you. And to make this change, RABT process uses many techniques. They fall within the realm of RABT, but there are three main types of techniques that clients will learn. Problem solving techniques, cognitive restructuring techniques, and coping techniques. So these are all involved in the process of RABT from the beginning. And human beings, again, I'm repeatedly telling, because this is the fundamental basis of RABT. Human beings are largely responsible for their emotions and behaviors. So if you have a client who comes with a disturbance to you, and you decide with the client's agreement, of course, to do RABT to your client. So first of all, you will have to make your client understand this principle that human beings are largely responsible for their emotions and behaviors. We don't, we don't disturb ourselves, we disturb ourselves not because of the activating event actually, but because of the view or the belief we have about it. So this you need to teach your client. This is a very interesting thing. The first thing that you teach your client is this, because we want them to accept the emotional responsibility. So that's a little technique called the 100 people technique. And here, thoughts and beliefs are what cause the emotion. So this is based on that. And I would like you to now imagine there is a man who complains of problems with his father. So when you're starting RABT with your client, this is the first thing that you will do. And you ask them, imagine that he has problems with the father. Every time I see him, he treats me badly. I feel really upset and disturbed and angry. So what happens? The event is my father insulted me. The consequence is anger. So imagine 100 people, 100 men with a similar problem with their father. And in your opinion, all 100 will be angry. Or will they have different disturbing emotions? Do anyone like to let me know whether all 100 will? Just put a hand up if you think not all 100 will be angry, only angry. Yeah, there is the hand, icon there down there. If you can press it, can. Yeah. It's okay. Yeah, at least one person. I can see you on only on the screen. So in our opinion, you don't think that all 100 will be angry because the father disturbed them. Do you think so? Yeah. Okay. So let's move forward. And now what happens? Just to explain this, you see, my father insulted me, who can get angry, and another person, father insulted me, they can become, guilty. It's my fault. I deserve this. My acceptance of father's behavior goes on there, and he can also become fearful because of being beaten by the father or being chased out of the house. Or another person, another category can think, this is so funny. My father old, and when he behaves like this, it really humorous. Or others will get rejected. So how will this, what came to his mind, this man's mind, these people's mind, just before they got angry or just before they got upset, angry or depressed or whatever? Can you think of that? Just before they got angry, what thoughts came to their mind? So we depend on this to take our clients to the ABC model. So this is what happened. The thinking came before the consequence. Father insulted me, the person is angry, and the thought that came to just minutes, seconds, split seconds before he became angry is, this is injustice. I don't accept when lines are crossed. I will give it back to him. So this is what caused the anger in the person who became angry, these thoughts. Then what about the people who felt guilty? And then the father insulted me. He's right. I am a useless idiot. I deserve this. And they accept the father's behavior. Or they will become scared. Worse consequences are going to follow after this. So they become fearful. Or another category then can think, old man, he can't change. What he says is not true though. And they will have a good laugh about it. And another category can think, it is so ridiculous, my father has treated me this way, and they become depressed. Now, it is so clear that what the constant is, the father insulted, father insulted, father insulted, but the responses are all different. And the responses came out through the thought processes that they went through just before expressing the anger or the guilt or so this is the 100 people technique. 100 people will respond in 100 different ways probably to the same disturbance. So I like you to do a little exercise on your own, in your own life. I'll give you a few minutes, 10 minutes, 5 minutes, 10 minutes. Think about some disturbing event of your life, please. And think about your response, the emotion. You can have many emotions towards different events. It can be anger, it can be depression, it can be anxiety, it can be hurt, anything that you have gone through. And think what came to your mind before the response. Okay, just let me, yeah, you can take a few minutes to do this. And soon after that, we will take a break and we can talk about it when you come back. All right. Okay, let's talk about it then. I think some of you are okay to talk about it. All right, anybody wants to say anything? It's okay. Okay, few minutes if you want to say anything, and then we can continue. All right. Okay, it's all right. But anyway, think about it.
Dr. Sumitra.
Yes.
Okay, so I would like to share my experience. So just 2 days back, like my mom was asking for some money to go on a trip. So I was the intermediate person to get the money from my dad. So he didn't give enough what she asked for. He just gave like half of what she needed. So she chose to show her anger on me, and she started saying, "Okay, fine. If you all are not going to give that amount of money, I'm going to cancel my trip." So at that part, that second before I got very depressed, and the way I reacted was like I did not go down to have my breakfast. I didn't want to go out with her to have lunch and all these things. I was like starving myself the whole day and all. But the thought that just came just before that, that depression part was, is she blackmailing me? Why is my own mother blackmailing me? So that was the
Okay.
thought which actually brought me down. That's all. Thank you.
Yeah, very good. Thank you so much. That's really good. Yeah. I don't know whether anyone else want to say anything. If want, take a minute and say anything you want, but otherwise we can continue. Okay. Yes. So that was a very good example of what exactly is this, emotional responsibility, the belief. She had a belief. Is she blackmailing me? And that thought, the response was she was disturbed and depressed, and you heard her story. So, yeah. So, all we did just now. Now, the important thing when you are doing REBT with your client is that clients understanding this principle is important. Therefore, we teach them by taking them through this exercise until they understand it and also accept it. That means they accept the emotional responsibility. Okay. So this is a little chart, how we will do this generally. The A causes, B causes C, and A can be any kind of trigger event, generally unpleasant or adverse. And then the person can have a belief towards this. If the belief either can be healthy or unhealthy. So if the belief is healthy, there is no issue. But the beliefs are unhealthy, the consequences will be all those. The emotions are unhealthy, negative thoughts, feelings, and a lot of action tendencies and all that come in. And this is where your client is disturbed. And this is the point your client will come to you. So very briefly, when they come to you, we identify the emotions, and then we identify the activating event, and then we identify the belief to see whether it's healthy or unhealthy. And then if it is unhealthy, we take our clients to REBT. If healthy, we don't. So there are many exercises and a lot of talking, conversations happen during this process. And together with the therapy, the client identify unhealthy negative emotions, activating events, unhealthy beliefs, and through a series of exercises. And eventually, we have to identify, is the client's belief healthy or unhealthy? And we identify there are exercises to do to identify this. And then if the beliefs, thoughts, everything is unhealthy, we go forward with the REBT process. And people can have behaviors. We also behaviors like avoidance, maladaptive behaviors like taking drugs, alcohol, and all that because of the disturbance. We also handle that, and we teach them how to cope with this situation. So the ABC is understood by the client, and the client is committed. Therapist and client begin the process, assess the emotion, and then assess the critical activating event, and then we go to the the belief. And once the belief is identified, we work on the belief. And there are a series of exercises that we do to identify these. And then when the belief is identified, what we do, we dispute those beliefs. Those are all the very those are the very important exercises. Once ABC is done, sorry, you have to do the disputing of those unhealthy beliefs, and then we convert them, find the healthy corresponding beliefs, and then we incorporate that into their belief system. And this is what will actually bring the client a permanent change for that particular issue. And then the steps are, as I said, disputation and integration, we call it. And in the end, the client is prepared for integration. And then through various structured cognitive and behavioral exercises, the integration is done. So each step of the way, many techniques and exercises are used to make this process complete. And if practice regularly this method, which you learned during the REBT process of your problem, then if you choose so, you can become your own therapist. So this is the most important thing. The lasting change is what is important in REBT. And the philosophy is that, okay, so I am going to just let you know some about like 2 case histories that I have, cases that I have done from some of my case. Just let me get off this. Sorry, thank you. Yes, okay. So anyway, I don't know, you can ask a few questions now, or I can talk about the cases. If you have any questions, you can ask, but otherwise you think, and then once I finish my case, letting you know, then we can do the Q&A. All right, so I had one of my clients. Yes, Lavanya?
Dr. Sumitra, I just wanted to know, what if some clients are in denial, like for example, if it's jealousy or revengeful thoughts, like if they're not able to say it out loud, will CBT eventually help them to come
Oh, yes,
in?
yes, definitely.
Yeah, it will
Yes.
bring it up. Okay.
Yes.
Thank you.
So I had a client who was he was an elderly gentleman who was a very good orator. He he conducts coaching sessions and all that. Yeah, coaching sessions, and we'll do the Q&A later. All right. So I will just go through the 2 cases that I wanted to let you all know. So he was very good, very well sought after. And one day what happened was when he was giving a speech, so the front row people did not pay attention. They were doing all kinds of things. And then suddenly he got very anxious, thinking he's doing something wrong. And he couldn't speak, and he had to just leave the podium and get someone else to do this. So he came for this therapy. And what we did was um, going through the whole thing. Then eventually, we had to talk about, I had to talk about the unhealthy beliefs that he had. What were you, disturbed about? So, or what they were disturbed about, he was disturbed about us. I have to be confident when I start my speech. And I feel very uncomfortable when people are making, disturbances in the front row. And I must not look nervous. I don't want to look nervous. I want to perform, perfect. My speech should be absolutely perfect. I cannot do any mistake. So there were so many beliefs, rigid beliefs, that should not I should not do. So the event was that the client, the clients are looking at the people, they were not paying attention to him. And he got all these very rigid beliefs, and these all disturbed him. This is what caused the anxiety in the client. It is not that the act of seeing those people not paying attention to him, but the thoughts that came to him. I am not doing this well. I must do this well. I cannot continue anymore. And I'm useless. I'm not a good person who I can't deliver a speech even properly. And all those thoughts were the beliefs that were disturbing the client, and the client had to just leave the podium and go away. So we, through the REBT process, we worked on all those negative beliefs. So a lot of exercises, and then finally he got over his anxiety. Actually, he came back to, because he was a good person, a good orator earlier also. There was another case of anger, a very intellectual man, and he came with a lot of anger because his wife, because of his work, he had to be away from home for a while, in the working place, long hours. And then the wife did not like it, and he's from overseas, and wife took the children and went away, went back home, and he was very angry about it. So he couldn't actually control his anger. He started throwing his anger all over the place in the workplace, and he was becoming very unpopular also. And then we also went through the beliefs that he was having. We identified them, and that which was causing the anger. She should not have left. She should have told me she should have discussed with me, and she disrespected me, and so many unhealthy beliefs came out. And then we worked them all through the process of REBT. And eventually he was also hurt, and we handled the hurt also. And finally, he actually left the job here and went back to the people, thinking that that's the way to go. And he, in fact, informed me that he's very happy that he did that. Yeah. Okay. Then if you have any questions, can you quickly ask anybody? I can't do details case history, but these are some of the things that you can work on.
Hi, I actually have a question.
Yeah.
I wanted to know, what is the difference between this course of CBT and the ones that are offered in universities where they also teach modules of CBT or related, like in counseling or in psychology? Yeah, I just wanted to know the difference. Thank you.
Yeah, very commonly, those institutions, they offer another model of CBT, which is the Beck's model. Generally, Beck's model is the most popular, and then Elisa's model, they go, equally popular. And CBT is a little different from, I can't tell you the differences right now, but it doesn't have a philosophical tone to it, like REBT. Okay, but they basically they have the same kind of platform. They have the same method of taking clients through to change the cognitive patterns that they have been they may come to you with, that are causing the disturbance. Is that okay?
Yep, thank you.
Okay. Any other person?
Yeah, hi, Dr. Sumitra. Thank you for that lovely presentation. It was very informative. I just wanted to ask you about, I believe there's a program that will be launched. There'll be a course of sorts that you will be conducting. So I'm just curious to know whether the certificate that we will be receiving, would that be certificate in CBT, or would that be certificate in REBT?
REBT.
Okay. Right. So it's kind of CBT.
It is CBT.
Yeah.
But the version you are getting, Peter, can you help me out there?
Yes, I mean, you'll be getting a essentially a certificate in CBT. Bearing in mind what Dr. Sumitra has been saying, that REBT is a version of CBT. So they're kind of very, very connected. They're both equally popular out there, and they come under that heading of CBT. So that's what the certificate will be.
Right. Thank you
And
so
I'll give you
Thank
I'll give you all an overview in a minute of
Okay.
the course and course delivery.
Thank you so much. That was really interesting. Thank you.
Anyone else? Any questions?
Shall I give them an overview of the course itself and then see if there's any questions after that?
Yeah. Okay.
Okay,
Thank
so
you,
I'm just going to come back to you, Dr. Sumitra, in a moment. Let me just go into my share just to okay. Please just bear with me. We'll see. They've done an update on. I'm going to have to go in there. And they've done an update on CBT. CBT. They've done an update now on Zoom, and it's doing all sorts of weird and wonderful things with. There we go. The share button. Okay, so the course itself, I mean, Dr. Sumitra has admirably covered a lot of information, and everything she's been talking about we teach on the course. So you've got the core CBT concepts, so we're bringing in the ABCDE model, the challenges of healthy versus unhealthy beliefs and emotions. And within all of this, we are building up people's confidence to use the CBT concepts for yourself, obviously, teaching a very powerful way of helping you to challenge your own thinking, but also for your clients that you're working with, and also for your own levels of communicating with others. So you communicate with yourself and challenge yourself. The way you communicate with others, you can bring these concepts in. And there is also an understanding here of what psychological disturbance is from the CBT and REBT concept of it, and interactionism as well. And so, we're learning to rewire thinking patterns very much. And what we're looking at as well, we're all as therapists, as people interacting with the community, we are looking at helping people here to develop the unique approaches within that particular structure of CBT RBT that suits each individual client. So instead of pushing a particular structure on people, we're looking at the person and developing and evolving around that. And if you think about it, there are 5 really good reasons to take this particular course. One, you've got the transformation of lives, not just your clients' lives, but also helping you to transform your own lives. It really is a great way of learning how to manage your anxiety and so on. With regards to what you're doing and how you're looking at yourself and looking at helping others. It's science-backed. We know that. There is so much research that has been carried out based around CBT, REBT, time and time again. It's been shown to be really, really effective in helping people to transform the way in which they're living their lives. The course itself is very, very hands-on. It's a very practical delivery that we give. It's not just about us teaching you theory. It's about us helping you to practice on yourselves, apply that to yourselves, but also apply it to the clients that you are already working with. And as such, you're kind of opening up career opportunities within yourselves. So to be able to add this skill to what you're already doing, it gives you greater opportunities to be able to look at pulling in other types of clients for yourself, being able to work within corporations using CBT skills and so on. So it's really a case of upskilling yourself. And also learning to rewire thinking patterns. Your thinking patterns, the thinking patterns of others, because it's, it is the way in which we think about the world and that we interact with the world with that thinking and belief that determines how we are going through that particular experience of the world itself. So what we have with our delivery, we've got 5 weekend lecture sessions. There are 5 midweek tutorials that are there to help you understand the course itself, the material that's being presented, to help you understand how you apply it to others. There's a revision session as well, and the exam itself is a short answer question exam and submitting a case study where you've been using CBT, REBT with real life clients. And you may be aware our next course intake is the 5th of April. And as I said earlier, you get the certificate in cognitive behavioral therapy that we provide. And also to kind of put it into a context, the course itself is effective as a standalone course. It really is. It's superb. But also, it's also comes part of our APTIP qualification, which is the Advanced Practitioner Diploma in Integrative Psychotherapy. So, as I say, on its own, it's great. You can integrate it into your practices. You can work with your clients, bringing in these approaches. But it is, as I say, part of the integrative psychotherapy diploma that we run. And just so that you're aware of that, it basically comprises of our EMDR course plus our ego state therapy course and the integrative psychotherapy course. So we talk about what integrative psychotherapy is and the concepts behind it there. And either, you don't have to have done hypnotherapy for these courses. So if you are not a hypnotherapist, you would do the CBT course. There's 4 courses that comprise this particular approach. Or if you have done hypnotherapy, you've got a choice. You can either do our ABPP course, or you could do the CBT course that we're presenting here. And then after if you've done those, there is an award. There's an essay or case studies we asked you to do, and on successful completion of those, you'll get awarded the Advanced Practitioner Diploma in Integrative Psychotherapy Award. So that kind of puts it into the context for you. And of course, you've got Riska and Nasrat in with us. They're your contact people for more further information, which would be really useful. If you really want to ask any more questions about the course, the delivery, fees, etc., they'll be letting you know more and more about that. But CBT and REBT, it's such a great addition to what you're doing already within practice, or either as a healthcare professional, you can integrate these skills into the way you communicate with your patients, or as a therapist, integrating these skills to help enhance your psychotherapy. And there is some really nice research that is showing that hypnotherapy plus CBT, REBT produces some really, really good outcomes. So as an integrative skill, it's wonderful. As a skill on its own, it's wonderful. Nasrat and Riska are there for you to talk to as well. And so are we. I'm going to hand back now to Dr. Sumitra, who will be open for any more Q&A. Over to you.
Yeah, can I say something while you're thinking about the question at least? Peter just mentioned about, CBT can be practiced with all the other courses that other certificates, other courses that you may be doing, including hypnotherapy. So what I generally do is I can choose whether to do the CBT for this person or hypnotherapy for this person. So when I choose the client with to do hypnotherapy for the clients, what I do is every opportunity I get, I will bring in CBT exercises and CBT philosophy. I will discuss with them. And this 100 people technique, all the time I do with my clients. And there are so many others that as you go on, like things like there is a exercise called cost benefit analysis, and so many things that I include so that your client will more than sitting and experiencing hypnosis, they will start thinking too. And they get a better understanding about their problem. Why am I so disturbed? And so on. So sometimes I actually combine the two, generally the exercises and the explanation about disturbance. You can call it psychotherapy also, and making them understand what exactly is going on in you. And also there are so many things happen during this particular treatment. Cognitive restructuring is happening. And, also like, let us say your client is having always unnecessary thought, new neural pathways are being established. Through it is such a powerful cause actually, and you really think of it. It's really, really good. And you can make a lot of changes in your client's life using REBT. It's a very good. Yeah. I really enjoy, and when you are learning it, you will enjoy it a lot because we have a lot of discussions. It's really going to be very interesting. Everyone who has done it, they really like it and they enjoy the course itself because it is so hands-on and it's so discussive and so on. And you learn a lot. A lot of people solve their own problems sometimes during the course itself, because we encourage the clients to take disturbing something that is going on in your life, whether you're anxious about something, you are fearful about something, you are depressed, you can get some event and process it through the course as you're doing it. And you will come to a lot of insights, and very often your disturbance will become so manageable.
I think one of the things that's really is exciting about it, going through the process of the process we talk about, you get some amazing insight into what's going on in our own heads as humans.
You don't have to discuss it. Peter, sorry.
No, just saying, the thinking processes, even though we're therapists, even though we're professionals, the thinking processes we take for granted. Sometimes when we're learning something new like this, you sit back and go, oh, actually. So it is a very insightful element.
Everything like things like reframing. Throughout the course, you're reframing their thoughts and their beliefs and their, anything that is negative there. It is automatically happening. We are not even doing it, but the process is such that you will have a lot of reframing happening, a lot of insights coming in, and a lot of new neural pathways automatically. But if you take the whole process, it's very, very simple. So simple, you can't believe that change can happen sometimes.
All very exciting.
Yeah.
Okay, everyone. Let's noticing the time for you all, and I'm sure people in Southeast Asia would like to get into their evening, and also in the UK, well, we're going into our afternoon. And if you're in Australia, time for bed, I think, for you guys. So, so thank you, Dr. Sumitra. Thank you very much. Remember,
You're welcome, and thank you, everyone.
Always a pleasure to have you talk. And if you've got questions, please do drop Nazrat and Riska a message. Their details are in the chat, and I'm sure they'll be contacting you as well, just to afterwards to say thank you as well. So, I don't like saying goodbye, but what I do like saying is see you soon. So take care, everybody. And again, thank you for Dr. Sumitra. Thank you to Riska and Nazrat, and also to Julian and Shamala from the team who are hiding in the background there, just keeping things going behind the scenes.
Thank you, Peter. Thank you, Dr. Sumitra, and everybody for being today.
Thank you. You're most welcome.
I
really hope to see you all in the class.
Lovely. Thank you, everyone, and take care. Have a lovely evening, afternoon, or night sleep if you're in Australia.
Thank you. Thank you so much.
Thank you. Thank you, everyone.